How does pancreas MRI distinguish pancreatitis from early cancer? Imagine trying to tell apart two very similar-looking puzzles. Both involve the pancreas, but one is inflamed, and the other is developing a tumor. Magnetic resonance imaging, or MRI, helps doctors solve this puzzle by providing detailed pictures of the pancreas and surrounding tissues. Because MRI uses powerful magnetic fields and radio waves, it can produce high-contrast images without exposing patients to radiation. This makes it especially useful for examining the pancreas, which is deep inside the abdomen. When doctors look at MRI scans, they look for specific clues. In cases of pancreatitis, the pancreas often appears enlarged and shows increased signal intensity on T2 weighted images. This means the inflamed tissue looks brighter because of swelling and fluid buildup. Sometimes, there are signs of fluid collections around the pancreas or swelling in nearby tissues. These features suggest inflammation rather than cancer. In contrast, early pancreatic cancer usually shows up as a small mass that appears darker on T1 weighted images and can be either bright or similar in brightness on T2 weighted images. These tumors often have less blood flow early on, so they tend to show diminished enhancement when contrast is used in dynamic MRI scans. Over time, the tumor may gradually take up contrast, helping radiologists distinguish it from benign conditions. Advanced MRI techniques add even more detail. Magnetic resonance cholangiopancreatography, or MRCP, creates clear images of the pancreatic and bile ducts. If a tumor blocks or narrows these ducts, it can be a sign of cancer. Multiparametric MRI combines different imaging sequences, improving the ability to spot small lesions and tell benign from malignant growths. In clinical practice, MRI is often used with other tests like endoscopic ultrasound and computed tomography scans. For people at high risk of pancreatic cancer, MRI can be part of regular surveillance to catch early signs before symptoms appear. While MRI provides valuable clues, interpreting these images requires specialized expertise. Sometimes, a second opinion from a radiologist experienced in pancreatic imaging can make a big difference. In summary, MRI helps distinguish pancreatitis from early pancreatic cancer by revealing characteristic tissue changes, ductal abnormalities, and patterns of contrast enhancement. It's a powerful, non-invasive tool that, when combined with other diagnostic methods, improves the chances of early detection and accurate diagnosis. Always remember, if you have concerns about your pancreas health, consulting a healthcare professional is essential to get personalized advice and appropriate testing.